So I'm going to share my screen and share some a presentation, and I'll walk you through kind of everything. I just got off a call with two other doctors talking about show up rate. So let me
Yeah.
walk you through kind of, let's go into it. Okay. So can you see my screen? Okay. So a couple of quick things. Show up rate depends on process, language, and the videos. You know that. Okay. Now let's talk about the psychology part of it. Okay. Patients must feel an emotion. So the emotion we want to trigger at this or elicit in the comprehensive visit is guilt, shit. I've been using my phone way too much. I'm not blinking enough and I've got this thing. And we want to have pain. We want to have pain for the patient. Otherwise, people don't move. Human beings move and change to do an outcome Amy and Dr. Z want because they're in pain of some sort, or the doctor told them something, okay? The second, I'm going to walk you through what that looks like, okay? And it's them who did something wrong. When you have proof, a mobography, it's an objective clinical assessment, what you're going to say in the comprehensive visit, and ultimately how you make them feel, again, in the comprehensive visit. Now, I'm going to walk you through the 3 hats strategy. The 3 hat strategy is probably the most effective strategy we've seen for getting patients to move forward into treatment, okay? So let me give you kind of a quick example here. I talked to a doctor on Friday. She does myopia management. I spent 3 hours with her in her office. And I asked her, I said, what do you say to patients about myopia with their child? Myopia means nearsightedness, it's getting worse, and well, don't worry, we have treatments. Don't worry, everything will be fine. We'll take care of it, and then just come back and see us. Something like that. And I said, well, you're letting the patient get away, thinking everything's gonna be fine. So why the hell should I come back?
Yeah.
Right? So you need to make them feel something. So the 3 hat strategy, I'm gonna walk you through here, is in the comprehensive visit, and it's also for the ocular surface evaluation. Call it 3 hat strategy. First is the doctor hat, second is the educator hat, and third is the mind reader hat, okay? So what does that mean, Bob? What does that mean? What does that look like? I'm gonna walk you through each step, each of it, each part of it. So the first is the doctor hat. My biography is done in the comprehensive. You show Mr. Jones on exam, you're already doing this. Your glands are atrophying. These are little meibomian glands, mini tubes in your eyelids. And when we blink, we create that beautiful, healthy oil. They're getting clogged, okay? So that's the diagnosis, clinician, doctor. Second hat is the educator hat. Now we want to talk about the why. The why is very important. We might not just go from doctor to treatment. This is the very crucial. So why is this happening? What's happening is as COVID and screens have changed everything today. We're all on our phones a lot more. And when we're staring at screens, we're blinking 12 times less. Shivali, is that the number 12 or is it like 10? I forget what it is. But it's like 12 times less. We're blinking 12 times less. We're blinking 75% less. So you're educating. You need to educate the patient about why this is happening. Not like, you don't want to get too technical. What I say is, look, we're all on our phones more. We were last year than we were the year before that, and we're going to continue. So we're watching Netflix on our phone, watching YouTube, watching more and more content on our phones than ever before. And as a result of this change, our eyes are suffering, and you've got something worsening in your eyes, okay? So you got something worsening, something that's getting worse, it's deteriorating, your glands are atrophying. Is this you, Mr. Jones? Are you spending a lot of time with your phones, even at home, and doing a lot more near work like Zoom and things like that for your job or whatever, right? And they're probably going to say, yeah, that's kind of me. And the doctor has to say, or you have to say, Amy's like, yeah, we get it. Like this is society today. We're living this today, right? So that's that.
Mm-hmm.
Okay. So you made the educator hat. Okay. What I want you to do is I need you to come back to see me in about a week. I want you to book the ocular surface evaluation before you leave. I'm going to send you videos. Watch the videos for me. Okay. Okay. And there's 3 videos. They're coming from me. It's going to educate you before you come in. Okay. That's the educator part. The third and most important hat to increase show up rate is the mind reader hat. Most of the time, I think one of the challenges that in the comprehensive visit, talking about treatment, because the thing is, you've just diagnosed the problem, and all of a sudden you're presenting treatment in the comprehensive visit.
Yeah.
And then the pricing, it gets a little overwhelming for them. And they think it's like a bait and switch sometimes because they're like, I just came in for eye exam glasses. What is this thing? So, most of the best practices we've seen across the country, what they do is they don't talk treatment in comprehensive at all. Because then you go down this rabbit hole, how much, why do I really need it? I don't really feel bad. Like it gets into the whole thing. So and it's almost, some patients also, it backfires. They're like, I never heard of this problem. And then all of a sudden you're giving me a solution. Like, what? I don't understand. This is like, you're trying to sell me something and they put up that wall. You really need to bring them back for the ocular surface and then talk treatment. So I would say that if you talk treatment, so don't talk treatment, only diagnose the problem and have them come back, okay? Talk treatment, you go down this rabbit hole. I've had a doctor who said, patient was in my chair, she had symptoms. I told her about the IPL. The patient said no, went home, wrote a 1-star negative review on Google saying, doctor sold me $700 glasses. Then she told me about a disease I never heard of before. Then she magically gave me a solution that was $2,000. Never go to this doctor again. So it's just a patient perception. You're trying to help them, but it's about patient perception. So let's not even bother talking about their treatments and just say, look, I want you to come back for the ocular surface evaluation. Now, the mind reader hat is what they're really thinking is, I don't feel bad. What is the deal? What's the big deal? Right? Like, so you have to say, so Dr. Z has to say the following. You're probably wondering, doctor, I don't have any symptoms. Why do I have to care? Why does this matter? Say that. Dr. Z has to say that to them. You're probably wondering, I don't feel bad. Why should I care? And the reason that for Mr. Jones is because you won't feel anything until it's too late. And then we can't go back in time. Once your glands are gone, they're gone forever. Very similar to high cholesterol, high blood pressure. These are diseases that are destroying and worsening in our body, but we don't feel them until someone has a heart attack and they're like, geez, the guy was fine 2 days ago, right? He didn't feel anything 2 days ago. So it's very important that we mention, as a mind reader, we read their minds and address the objection that they have in their head. They're afraid to ask Amy and Dr. Z. They're afraid to ask. So you got to bring it out on the table. So first one is, I don't feel anything. What's the deal? And the answer is, Mr. Jones, you won't until it's too late. Your scans showed us the truth, okay? Scans don't lie. What we want to do is, so the 3 hats, just to refresh here, the doctor hat, the educator hat, and then the mind reader hat. First mind reading is, I don't feel anything. That's the first objection they have in their head. The second objection is, it's not that bad, I'll just use drops. So you're probably wondering, doctor, why can't I just use drops? And the answer to that is, drops are not the solution because they don't address the root of the inflammation that's going on in your eyes. They might give you some symptomatic relief, but they don't get at the heart of the issue, the root cause of the problem. And so that's why if you go to CVS or if you go to these pharmacies, you'll see lines and lines of drops. Is because you need them so often because they don't really solve the problem. They just give a symptomatic relief. So that's the second you're probably wondering. And then the third you're probably wondering, final one is, again, is like, they're sitting in your chair, you're telling them to come back for the ocular surface evaluation. They're like, why do I come back? Like, do I have to really come back? So you have to say, you're probably wondering, why do I need to come back, doctor, when I don't have any, problems right now and I don't feel anything? It's because we don't want things to get worse in our bodies. That's why you need to come back. I'm going to do a check to ensure and check your function, gland function, and to see really what's going on. Otherwise, if you do nothing, it's going to worsen and we can't go back in time. So it's covered by insurance. It's a quick 30-minute, visit. Promise you it's worth it. And that's why we come back, is because what we want to do is to kind of prevent the problems from happening in the first place. So the 3, you're probably wondering, after you say that, you want to say to them, does this make sense? Because then the answer is going to be, yes, doctor, it makes sense. Yes, doctor, it makes sense. Yes, doctor, it makes sense. And then at the end, you want to say, will you promise I'll see you back in a couple of weeks for the ocular surface evaluation? Yes, doctor. So in psychology, you want to get them to yes, 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 and then get into that. So that's the 3-hat strategy for comprehensive visit. We're going to deploy the same 3-hat strategy for the ocular surface evaluation in a second. But just to be clear, doctor hat, clinician hat, diagnose the condition using the myelography. The second, the educator hat, why this is happening. It's you, it's your, it's society today. We're on phones a lot. Make them feel a little bit guilty, and not in a bad way, but in a way that says, hey, listen, your behavior has changed. Our behavior has changed as society, right? And the way people take responsibility for an action is they feel like they did something. Like, oh, I have cholesterol, I'm overweight, I gotta stop eating burgers. So in a way, if you let them get away with just, you'll be fine, it's not going to compel them to come back and the show up rate declines. So what you've got to lean in with is, yeah, screens. I'm on screens all day because I'm with patients and I'm on EHRs all day long. I had the same problem. Just explain a little bit, like, see, this is a reality today. Everyone's doing that. So lean into the problem rather than the solution, at least in the comprehensive visit. And bond with them. And the thing is, the likelihood, I think you're 100% right, the likelihood of doing something is not going to happen. That's why people are on cholesterol meds, because they can't lose weight and exercise and do all that stuff themselves. But I think to the point is that in the comprehensive visit, you have a very short window. And if you confuse them, you will lose them. If you think about the ocular surface evaluation, again, the 3-hat strategy applies.
Usually 3 things happen in the ocular surface exam. You look at their tear quality. Number 2, you look at their inflammation in and around the eyes, visually, and we do inflammatory eye. And number 3, you look at the gland function. That's the 3 things that should happen. And that's how you should open the ocular surface evaluation appointment as a doctor. Hey, today, I brought you back. We're going to do 3 things that's going to give me more data to see how I can help you and, get you back on the right path.
Okay.
Success. So start with that, and then doctor should close. This is what I found. Number 1, number 2, number 3.
The second part is the educator part of it now. So the educator part of it is very important. Is like after you make the diagnosis, you want to educate them. So if you go, so you have meibomian gland dysfunction, the scans show that, all the testing showed that it's going to get worse if we do nothing, and we can't go back in time. And so I'm going to prescribe you a personal plan here. And so here's a summary of some of the therapies out there. I'm going to prescribe you some omega-3s here. I'm going to prescribe you some tears, but let's say omega-3s, loosen up that hardened oil that's in your glands. And then I might prescribe you, let's say, warm compress or something. Definitely want to reduce some screen time. And then I'm going to prescribe you an IPL, okay? And then, so you want to point to these as a personal prescription plan for you, because patients want to know, like, there's got to be 2 or 3 things, okay, that's going to be in the plan. And then now let me walk you through what an IPL is. It stands for intense pulse light. So when you open these, it gives the doctor a lot more confidence, and then the patients feel that. You should have it open for her before she walks in, before the patient walks in. Have it open. And so what we're going to talk about is we're going to show you. So again, go back to the thing dashboard, summary of therapies, number 1. And then the second one, if the Optiolite is what you're using, and people remember 30% of what you say, 70% of what you say and show them. Recall has to, remember, patients have to go home and justify this expense to their spouse. I'll tell you how to get it. That's why it's really important that you show them intense pulse light, because they're going to want to know what to say to their wife when they say, honey, I got to pay $1,600 for something, right? So then you say, what is IPL? It's painless, FDA approved. It uses gentle pulses of light, and the patients are like, oh, it's light therapy. Yeah, it's light therapy, reduces inflammation and melts thick secretions and unclogs meibomian glands. We unclog these glands to get flow again. Mr. Jones, what other things do we unclog? Toilets, yes, we hate toilets that are clogged. Arteries, yes, we unclog them to get flow again. When I said that word to you, Amy, you're probably visualizing toilets and arteries in your head. The point is that patients do the same. Then they're going to go home, say to their spouse, oh, my glands are clogged. You see, that's the reason we show this. And then we say, well, here's what happens during treatment. These shields are placed over, cooling gel, and then around. So again, you're just going to skim through it real briefly. But when you point, it looks like harmless. It doesn't look like it's invasive. And it's 4 treatments over a course of 4 months. And the first treatment, you feel good. And I know that we covered a lot in this, but this is a very important treatment. I'm going to prescribe for you because it's going to get to the root of the problem that we want. And let me just send you a video on this, Mr. Jones. When you come in here, Amy, and you toggle that button, the OptiLight button, okay? It's done. So because that button is going to send them a text and it says, hi, this is what we discussed. This is OptiLight. The reason, this is the education part of it, right? You're saying to them, I'm going to text you this video is because you know they're going to go home to think about it, right? And when they go home to think about it, you need to live on their phone because most of the time they make a decision in the kitchen or the bedroom at home when they go home, talk to their spouse, and it needs to live here. Hey, honey, what happened to the doctor today? Oh, my glands are clogged because I'm on screens a lot. And so what did the doctor tell you to do? Oh, it's something called light therapy for my eyes. What's light therapy? Oh, it's this. You see? They're like, oh, look here. And the spouse is like, oh, let me see that. Okay. Oh, that's cool. How much is it? $1,600. Oh, okay. Versus nothing. Like, what are you going to do? They don't even know how to explain it. You need language to give them that they can justify it to their spouse. So that's the education part of it. So you're going to give them the presentation broadly, then you're going to go into specifics about them, whether you're using the Envision, RF, or IPL, whatever you're using. And then the third hat now. The third hat is mind reader hat. What are they thinking? They're thinking, why do I got to do this? Right? So Mr. Jones, you're probably wondering, Doc, I don't feel anything. Why do I have to do anything at all? Again, repeat, because your glands look like they're atrophying, they're going to get worse. Your screen time is not going away, and you're not going to feel anything often until it's too late, and then we can't go back in time. So that's why. Does that make sense? Yes, doctor. You're probably wondering, doctor, why can't I use drops or compresses or just blink more? Well, because drops are not going to get to the root of the inflammation. That's the problem. And also the blinking, while helpful, it doesn't get to the root of solving the problem you have now, which is gland loss or getting your glands are, atrophying or they're clogged, right? They're clogged. So does that make sense? Yes. Then the third big one, you're probably wondering, how much is it? And why doesn't insurance cover it? So the answer to that, Amy, is it's insurance doesn't cover it because insurance companies have not caught up to the latest advances in treatment for things that just started happening in the last 10 years, especially since COVID. Remember, it took them 20 years to cover mammograms, right? So, and it's $400 a session. So whatever you're charging, and it's $1,600. And then what you want to say is, the doctor should say is that, look, I'd rather have you do this than to spend thousands of dollars going to a drugstore month on month after month after month, year after year, and not getting relief. Mm-hmm. And then you want to stop and say, look, let me recap. And again, the last thing is, you've got your data, your findings show gland loss and a real problem. Screens and our society today and your glands are the result of the screens and all this we have in society today. And I believe that this IPL is the right solution for you. I don't think that warm compresses and drops and all these other things, while helpful, are going to get to the root of your problem. So I think you're doing the right decision. So let's talk to Amy. Let's get you signed up for your visit. That's it. Okay. So the three, again, the third hat was a mind reader, the three objections. The reason we call it the mind reader is because people have objections in their head. They're afraid to ask. And that's why we want to make sure you ask, that you address it. You address the elephant in the room, basically. So again, you want to give them something they can tell their spouse. Your glands are clogged. So Mr. Jones, your glands are pretty clogged. They need to, otherwise they're going to die off. We don't do something. And this is an important time. We can't go back in time. This is the time to do it. And just going to the drugstore is not the solution. So as doctor said, it's important to get this done sooner rather than later. You go home and we'll talk. We'll check in tomorrow. Okay. Right. Thank you. You call them tomorrow. Okay. Don't wait. Okay. Doctor wants to get you scheduled because it's fresh in their mind, right? It's fresh in their mind. And they're like, oh, I haven't made a decision. Okay. Well, let me check in with you tomorrow. Okay. But the doctor wants to sort of get, okay. Then you check in with them tomorrow and say, okay, let's get you scheduled. They schedule it. Amazing. Signed up. If they say, you know what, I want to wait a little bit. You say, no problem. But don't let them get off so easily. Doctor has homework for you. And that's where you activate the nurture campaign. Okay.
Okay.
So you say to them, doctor wants you to do homework, Mr. Jones. She's not letting you get away with your clogged glands. And then just make sure what you're doing in here, Amy, is just you want to make sure that you're putting, after they do the first IPL, you just toggle that button.
Okay.
Okay. It just sends them that video. The reason we toggle the post IPL treatment is because it marks as at complete and signed up.
Okay.
So this way the system knows and we know how successful you've been, because then when we evaluate how you're doing, how your business is, I know, you guys look at this, it's if you look at your report card, let's say your report card back here, you see how many, you activated, and we'll see, oh, you activated all these treatments, but no post-treatment.
Okay.
If you activate your post-treatment, then oh, we had 2 signups or 4 signups or 10 signups. You know that.
Tell them everything about IPL and they go home with nothing to collaborate with their spouse on with.
Yeah.
Okay. So we must send the video of the IPL, plus also give them something to hold on to take home.
So just to summarize, show up, raise your hands, and process the language in the videos, of course. The feeling, the emotion, the guilt, the pain in the beginning is very important. People will not move to change anything in their life unless they feel some sort of pain, right? Showing proof is very good. What you say is very important in the comprehensive visit, and then how you make them feel. And it's the 3 hats: the doctor hat, the educator hat, the mind reader hat. So I don't want to go through it too much, but those are the 3 hats in the comprehensive visit and the ocular surface evaluation. I think you're good.